During the COVID-19 pandemic response, Dr. Robinson has served as the physician lead and medical technical specialist lead for the hospital's incident command structure. Prior to joining Christus Health, Dr. Robinson served as Deputy Secretary for Health Promotion and Disease Management for the Commonwealth of Pennsylvania. In that role, her focus was on preventive health and wellness programs geared toward improving the well-being of all Pennsylvanians. She completed the Robert Wood Johnson Foundation Clinical Scholars Program at the University of Pennsylvania, where she also served as a fellow in the Leonard Davis Institute of Health Economics and the Penn Institute for Urban Research. Most recently, she graduated from the prestigious Presidential Leadership Scholars Program, a national program that brings together leaders from across nonprofit, military, public, and private sector fields to learn leadership lessons firsthand from 4 past presidencies. She received her medical degree from Duke University and completed the internal medicine and pediatric residency program at UNC Chapel Hill in North Carolina. As both a practicing internist and pediatrician, she cares for patients of all ages. She's originally from Buffalo, New York, attended a HBCU, which was Spelman College at Atlanta, Georgia, where she graduated summa cum laude with a degree in French, and recently serves on the Board of Trustees as the college's youngest ever alumni trustee. So I present to you this morning our speaker, Dr. Lauren Robbins.
This is such a moment for our community. And I'm just really blessed, I think, to be here with you all today. And I think we are at a blessed and pivotal moment in our nation's history, present and future, as it relates to just the future of the nation, but then as it relates also specifically to COVID-19 and what we can do as a community to keep ourselves safe, and then what to do if we do end up with this virus. And so that's why I think it's so important to get this information out. And so I'm going to talk a little bit about COVID-19 in general, and then I did receive the list of questions that people had submitted, and then I'll get into those as well. As you all know, COVID-19 is something that kind of emerged on the scene, and the reason it's called COVID-19 is because it was the last day of 2019. It was December 31st, 2019, when they identified and named this virus. It's not that it's the 19th COVID, it's just that they found it in 2019. And the initial thought was that this was going to be a virus that was probably mostly going to be in China. Some may eventually get to the United States, but the impact on the United States and on the world at the beginning, I think, was probably underestimated. We saw our first case in the hospital at Christus St. Michael in March. In March, we had about 5 patients. In April, we had about 9. And then those numbers just kept climbing and climbing. In May, we had thought we had seen the highest numbers we were going to see in the hospital. And at that time, we had mid-20s, about 25 to 30 patients in the hospital. We did start to get up into the 40s in July and got concerned and wondered what this would look like if these numbers continued to grow. What would this mean for our community? What would this mean for the hospital? And it turns out that 40 was not the highest number of patients that we would see in the hospital. And in recent weeks, we've seen as many as 66 patients in our hospital. And depending on how you understand or know about the bed capacity of a hospital or how many patients are currently in the hospital, we went from having about 1% to 2% of our patients in the hospital being COVID patients to having almost 30% of our hospital population being our COVID patients. So that was a pretty drastic increase, and it required us to think creatively on what we did in terms of our visitation policies, in terms of our infection control policies, in terms of our masking for our associates, and how do we make sure that we keep our workers in the hospital, no matter what department they're in, safe. And so that has been a challenge at times. I think one of the things that has been good about our community, both hospitals and our community in general, is that we got an early start on this. So we started meeting in early March just to talk about what would happen if this came to Texarkana, who would respond, who would take what role, how would the hospitals be prepared. We started ordering the appropriate PPE or personal protective equipment. And because of that, we haven't had any PPE shortages at the hospital. We haven't gotten to a situation where we've run out of beds. The hospitals are working together to stay aware of how each hospital is doing in terms of their COVID numbers. And so I think our response has been excellent. You know, I thank God every day that I'm in Texarkana and not Philadelphia, because the Northeast had a really hard time of it at the beginning, especially as it relates to PPE, number of infections, and actually number of beds in the hospital, and had a really hard time that we have just not seen here in Texarkana. Some of the things that I think have been interesting, I gave a talk about COVID about 2 weeks ago to the Spelman community, and at that time our numbers were actually it was probably 3 weeks ago. The numbers have been coming down. We were doing okay. We thought we were going to come into a lull, and that our numbers would kind of stay even until about December, when we thought between the flu and coronavirus, we would see this huge surge. And right after that week, we saw this mid-October surge that nobody anticipated. And I think Texarkana was on the earlier side of the surge. Part of that is because our community, because we're kind of a bi-state city, also draws a lot of patients from Louisiana and Oklahoma. And so our numbers have been higher during these surge times than you may have heard from other places. That said, we are not at a place where we're like El Paso. We're not having to set up tents in the parking lot. But we do need to take some steps as a community to make sure that we don't get to that point. We don't want to have the military having to come in, set up field hospitals, taking care of people in tents, especially as the temperatures start to drop it, and that we really want to make sure that we're able to take care of our patients at the hospitals. In terms of how to keep yourself safe, really the best thing you can do is to wear a mask. We had a conversation with the local judges and mayors yesterday about how important this is. I would say that the hospitals in general, Wadley and Christus St. Michael, have kept a policy where we have universal masking, meaning anyone who comes into the hospital has to wear a mask. You may not know this, or you may be aware that the governor of Texas, Governor Abbott, actually still has an executive order in place that requires the wearing of masks in public places. That means if you're going to restaurants, if you're going to Walmart, if you're going to Super One, if you're going to Sam's Club, if you're going to Target, you should be wearing a mask, and everyone who's working there and who is shopping there should be wearing a mask. Unfortunately, there are people who either think that this virus is a hoax, or are tired of wearing masks, or think that in some constitution, I don't know where they read it, that they have a right to not wear the mask. And the issue is that by wearing a mask, what you are doing is preventing yourself from spreading the virus to other people. And so these people who are not wearing a mask are people who are going to be spreading the virus, and they may feel completely fine. We know that people can be asymptomatic and spread the virus, and that's why we're concerned about our community in terms of how do we protect ourselves. So the best thing we can do is to wear masks, wash your hands, and socially distance. Those are the three things. So wearing the mask, socially distancing. So if you look at at a lot of major shopping stores, there'll be stickers on the floor to help you distance yourself 6 feet from people, sometimes in the checkout aisle. For a while there, Walmart had special ways that you could go up and down the aisles, which I think was probably a little bit confusing. But the main thing is you don't want to be in close quarters with people in public places. Obviously, at your home, you don't need to necessarily socially distance from your family. But especially as we think about Thanksgiving coming up, and I know everybody really wants to see their family because we have been so isolated for so long, the public health experts are really recommending that people don't do large Thanksgiving gatherings, specifically because it's just difficult to socially distance when we're all coming together to fellowship. And then the washing of hands. We've known for a long time it's a big public health move that washing our hands helps decrease the potential for spreading germs, infections, not just COVID-19, but the flu virus. And so we highly encourage people to wash their hands. Probably, the first thing you do when you get home from work should be to wash your hands. If you go out in public, when you come back to your house, wash your hands before you're getting ready to prepare food or, handle a child or be close with loved ones. And that just makes sure that if by some chance you've picked up the virus on your hands while you're out in public, you're able to wash your hands and avoid spreading that virus at home. Those are the main issues and main things I wanted to talk about in terms of preventing the virus spread. I will say that the spread of COVID-19 is something that's likely going to be inevitable. Most of us will eventually get it. Some of us may have already had it and didn't even know. And I'll talk a little bit about the testing and what's available for that. But I ran into a gentleman the other day who asked me, have you had the COVID virus yet? And I think that's a good way of putting it, because the way that this virus is spreading, at some point you're going to be exposed, you may get it. And so it is important to know what to do. So and this is one of the questions that was submitted, what do I do if I'm exposed to the virus? And so exposed to the virus means that someone that you've been in close contact with, that means within 6 feet, and it's for a total of 15 minutes over a 24-hour period. So if someone in your house finds out that they have it and you've been around them, then you have been exposed. And so if you've been exposed to the virus, but you don't feel sick and you're doing fine and you're trying to figure out what you need to do, if you've been exposed to the virus, you need to, what we say, quarantine at home for 14 days. So the term quarantine is a term we use for people who are exposed to the virus but have not tested positive to the virus. Someone around you definitely has the virus, you've been around them, and you then, and this mostly applies to people who find out that someone has tested positive in their home, or someone that they're very close to at church, or someone who they've been maybe out shopping with or something like that. They need to stay at home for 14 days. And the reason we say 14 days is because we know that some people, when they're exposed to COVID, they get sick right away. In the first couple days, they might get fever, they might have cough, they may have sneeze. Some people, it takes about 5 to 7 days. And then there are a group of people that for whatever reason are feeling fine for almost that whole 14-day period, are getting ready to return to work. And then on day 13 or 14 might develop a headache or a scratchy throat and may develop symptoms. And that's why we ask people to quarantine for those 14 days so they can monitor to make sure that they don't develop the virus or don't develop symptoms. That said, if someone does develop symptoms or starts to feel sick, whether you've been exposed to somebody or not, if you start feeling ill, you should be evaluated. One, to make sure that it may not be COVID-19. It could be the flu, it could be allergies, it could be a simple pneumonia that's unrelated to COVID-19. But if you start to feel ill and get sick, and say you get tested, and you get tested positive for COVID-19. If you test positive for COVID-19, then you're asked to isolate. So someone who's being asked to isolate is someone who has tested positive for COVID-19 and needs to isolate so they don't pass it to anybody else. The term of isolation for someone who has tested positive for COVID-19 is, or the time that you can come out of isolation is after 10 days. So 10 days from when your symptoms started, if your symptoms are improving, and if you've had no fever for 24 hours, then you can return to work, you can be around your family members again. The thing that I think is difficult for people is around, if someone in your home tests positive, or if you test positive at home, how do you isolate yourself to prevent yourself from spreading that to other people? So what we ask people to do is stay in one area of the house. If you have to share a bathroom, or you have to share a living or kitchen area, which I would assume is probably everybody. I don't know too many homes that have 2 kitchens. But we ask that people wash their hands, wear a mask if you're coming out of the bedroom to prevent yourself from spreading that to other people in the house. And then, monitor yourself to see how you're doing. Unlike something like the flu, where you feel really bad, you get tested, and then after day 3 or 4, you're pretty much on the mend. COVID-19 has this phase where you start out, you may not feel that well, you get tested, you're positive, and then you seem like you're doing better. So day 3, 4, you might think, oh, this isn't that bad. And then for whatever reason, day 5 through 7, some people get very sick. So even at the hospital, we have some people who are coming into the hospital to be tested for COVID, and they get tested because they're not feeling too well, and then their first couple of days of not feeling well. But we have several people who have already tested positive for COVID-19 who come to the hospital at day 5 or 7 because they just get very sick. They have trouble breathing. They're having trouble keeping anything down or stay hydrated. And obviously that's what the hospital is there for, but we do ask people just to monitor their symptoms and know that we are here to serve the community. I would let people know that if you have tested positive for COVID-19 and you're not doing well, or you don't feel well, or you're just not getting better, the hospital, I would recommend going to an emergency room at the hospital as opposed to going to an urgent care or to a freestanding emergency room. And the reason for that is if you are very sick, and sometimes you might just feel very tired. And it's difficult for us as human beings to know what our oxygen level is in our blood. And you might just feel tired and short of breath, and you go to the hospital and your oxygen level is very low. And you might need higher levels of oxygen than is available at an urgent care or a freestanding emergency room. And you want to be at the hospital. So if you need to go to the ICU, if you need higher levels of oxygen, you're able to get those right there. You don't have to worry about being transferred, just because that process of a hospital, of an urgent care, calling a hospital, getting a bed, getting you transferred takes several hours. And so it's better to be at the emergency room if you're feeling like you're short of breath and having difficulty breathing. Let me look at these frequently asked questions to make sure I don't miss any. Somebody asked a great question, which is, are there any places that currently offer free testing? Currently in Texarkana, in our area, there aren't places that offer free COVID testing. On and off over the past few months, the state has come into the community to offer free testing. Different urgent cares, different churches, community organizations have had different events where they offer free testing. It's been several weeks since we've had some of those in our Texarkana area, but I would encourage people to keep their eyes peeled. I think as the numbers kind of go up and down, we kind of went into a phase where our numbers were going down, and so there wasn't as much interest in having the free testing. But as the numbers go up, our clinics and our community organizations have been able to offer that. And so you may want to check into that. Specifically, I'd say as we're going into this next week, I think there will be more free testing available in our community. Another really good question that was submitted, that is something that we get at the hospital quite a bit. If you test positive for COVID-19, do you need to be retested at the end of that 10-day isolation period? And the answer to that is no. So the CDC at the beginning of the COVID-19 pandemic released guidelines about how you kind of clear somebody or come out of isolation. And initially the thought was, well, we'll just test people to clear them at the end of the 10 days or at the end of the 14 days. And what they have found out is that a person who tests positive for COVID-19 can have a positive COVID test for up to 3 months. And so that means you might feel completely healthy. You may have no symptoms at all. You're probably not even transmitting the virus or anything like that, but your COVID-19 test, whether it's an antibody test, an antigen test, or a PCR test, no matter what type of COVID test you have, after you've tested positive, in the next 3 months, you can still test positive. And that is the reason that we tell people, once your symptoms are improving and you are 10 days out from when your symptoms started, you're likely okay to be cleared from quarantine. There are some employers who have different criteria for clearing people from their quarantine or the isolation, and that's because it does get a little bit confusing, I think, to have different numbers of days for different people. So for example, at Christus St. Michael, if you are exposed to somebody at home, you have to stay home for 14 days. If you test positive, you have to stay home for 10 days. And so trying to keep all of those things straight, some employers or some schools have opted for a 14-day hard stop. And that way, obviously, it's a little bit longer than that 10-day isolation period, but you can hold everybody to 14 days for that clearance from being isolated or quarantined. The CDC, however, says that you can use that 10 days of symptoms as opposed to retesting somebody. Another great question was, can you get COVID-19 a second time? The current guidance on this from the CDC is that it's rare for people to get COVID-19 a second time. However, this is very preliminary data, and so that's not something that I would go around putting out as hard science. We are starting to see, and we've been now doing this for about 9 months in the United States in terms of seeing the infections and seeing people in hospitals. We do see that COVID-19 has some people who have what we call relapses, meaning that they get COVID-19, they're sick, they get better, they're not having symptoms, no fever, no shortness of breath, and then maybe a couple weeks later, they get sick again, and they're short of breath again, or they start having digestive issues or nausea or vomiting or diarrhea. And it turns out that this is also related to their COVID. And this is what we're calling a relapse of COVID symptoms, as opposed to calling it a new infection. I think some of the challenges with COVID-19 is that because that test can stay positive for 3 months, you don't know if you test somebody again, it's hard to know, is this a new COVID-19 infection, or are they having a relapse of the infection that we tested them for a month or two ago? And that's why the CDC does not recommend retesting within that 3-month period. In terms of isolating, quarantining at the house, I think things that are important to have would be to have masks at the house. I see a lot of people trying to wear gloves out in public. The challenge with this is that we touch so many things. So people will wear gloves, they'll get out of their car, they'll touch their grocery cart, they may take it off to touch their face, they try to put it back on, they're touching the checkout screen, then they pull out their debit card to pay for their groceries, and they put their debit card away. Then they may leave the grocery store when they're all finished with everything and throw those gloves away before they get in the car, not realizing that those dirty gloves touch that debit card, and now that's in your wallet with everything else that you may touch. And then maybe I have an 18-month-old, and so everything goes in his mouth. His favorite toy this morning was the TV remote, and I was just looking at him like, this looks so gross. And most adults don't put things in their mouths, but having those germs that you either picked up at the gas pump or at the grocery store on your debit card is probably a problem in terms of COVID-19 being transmitted around. And that's why gloves outside of the house or outside of the hospital really aren't a great idea. I am a fan of antibacterial wipes. I think it helps to wipe surfaces down, in your kitchen when you're getting ready to prepare food, after you've prepared food. I think especially if someone in the house tests positive for COVID-19, it's worth having those wipes so you can wipe surfaces down, especially if you're sharing like a bathroom. It's a lot quicker to wipe the sink handles and the handles in the bathroom down than it is to disinfect and clean the bathroom with spray and paper towels or rags. So that I think that those wipes are a good idea if someone in the house tests positive. And you'll probably note that these wipes are hard to get. So if you go to Walmart or if you go to the grocery store, sometimes there'll be a sign that says, please take only one or limit to 2 per person. And that's just because as COVID-19 came into the United States, some of those production companies are here in the United States. Some are in China, and so in terms of importing things from China, that has dramatically slowed down. Shipping times have dramatically slowed down. The production of all of these items have slowed down, and so we're starting to see household cleaners come back more into our grocery stores and even online. But for a while there, we were in a dire situation as it relates to cleaning products. So there's some great question here. So somebody asked about Bowie County Clinic on 13th offering testing. I am not sure, Ms. Robertson. I will double check to find out if they offer it and if it's free. I know they were doing free testing for a while, but then I think as everything was going on in the state, I think they pulled some resources from the clinics so that people could do more mobile testing and mobilize people to go to different counties. But I will check on that. And then another great question is about children and COVID-19. So there have been a lot of national articles. I'd say I saw a lot of them in around July, August about Texas daycares and about how there's all these COVID-19 cases in Texas daycares. I think people were just looking for something new to report before the schools open, because now it's all about the schools having all the COVID or the sports teams having all the COVID. Viruses, bacteria, these are things that spread between people. And when people are in close quarters, they're going to be spread. So in April, May, June, the spread was primarily in our nursing homes and jails and prisons. And that's just because people are in close proximity to each other. Then we had summer and school was out, and a lot of schools didn't go back in person after spring break. And so now that school is back in session, we're seeing a lot more cases in schools. That said, we have not seen any severe infections in children in our area. There have been news stories kind of across the country about a child here who has that. There was a cluster of children in the Northeast who had a syndrome of a collection of symptoms after having the virus, but that wasn't reported outside of that area. And so that was something that it was good to know about and learn about. And I think it did probably instill a little bit of fear in people, but we're just not seeing the severe disease in children that we thought we would. For a long time, even after we got testing available, and I think a lot of parents were nervous because a lot of children have running noses. Children have been being tested in our community for quite some time, but we weren't seeing high levels of infection. That has changed over the last month. I know we spoke with our pediatrician, and she's starting to see more children test positive. But those children have not required hospitalization locally, and the hospitals locally have also agreed that if we have a child who has COVID-19 who is sick enough to be admitted, we're going to have a very serious discussion about making sure that our hospitals have the capacity to take care of them. If the child is severely ill, we will be having conversations about, does it make more sense to transfer that child to a children's hospital like Texas Children's or Dallas Children's or Arkansas Children's Hospital, just to make sure that they're at a place where if they need a specialist, if they need intensive treatment, then that would be the best place for them. So there's a good question here about hand sanitizer. So one of the things about hand sanitizer that I think is challenging is that it comes from everywhere. And so there are companies that call things hand sanitizer. It's always a giveaway whenever, it makes for a great, quick giveaway. We just don't know kind of who's making it and what's in it, especially now because there's so much pressure to create it. Companies are creating hand sanitizer everywhere in the world, labeling this hand sanitizer, sending it in. And I just think it's very difficult to trust the integrity of hand sanitizer at this time. I think it's better to physically wash your hands with soap. An antibacterial soap is great. We do talk about the fact that the more we use these antibacterial soaps, the more we'll see resistance to bacteria in the coming years and in the future. But I do think it's important to use those soaps to make sure that you're physically rubbing your hands to get those germs and bacteria and viruses off your hands. In terms of home remedies, so the CDC has started to put some guidance out about kind of the naturopathic things that you don't need a prescription to get. So every patient who's admitted to the hospitals, both hospitals in town, gets put on vitamin C, vitamin D, and zinc. These are things you can get over the counter. You don't need a prescription to get them. It's interesting because the CDC consistently says, we don't have great evidence that it works very strongly, but we also don't have great evidence that it doesn't necessarily work strongly. And so because of that, I think our physicians have continued to prescribe it. I know that a lot of the primary care doctors are also prescribing it. My mother takes her vitamin C and her vitamin D and her zinc every single day and swears by it. She also swears by her elderberry syrup. A lot of these things are naturally occurring kind of elements or naturally occurring food, and they have shown some properties that kind of strengthen the body against viruses. That said, drinking elderberry every single day is not going to prevent you from getting COVID-19. It's not going to cure COVID-19. It may give your immune system a little bit of boost as you go through the fall and the winter, like vitamin C does. But I would also caution people because elderberry syrup is very sweet. And so if you have an underlying condition like diabetes or something else, you do need to be aware that there's a lot of sugar in some of these syrups. And so take a look at those containers and those things before you're buying them so that you don't inadvertently end up raising your blood sugar when you're trying to stay healthy, and we want to keep you healthy. One of the questions in the chat is around how safe are our schools. I think the challenge there is that schools, children pass germs around. Part of that is because they put things in their mouth. Part of that is just by nature of them being in close proximity to each other. And so they're going to pass things, and for the most part, they're robust and they'll be asymptomatic, or they'll have a little bit of a runny nose and that's it. The challenge is that teachers are older than the children are. And so my mom is a school nurse, and her kids were always getting her sick much more so than they were being sick. And I think that is what happens with our teachers. Luckily, we haven't seen particularly high rates of complicated disease or hospitalizations among teachers in Texarkana. I do think that as we go into December, I think we'll start to see more studies coming out about exactly what the fall season has meant for teachers, caregivers, folks who work in schools. I think the challenge is that the public health experts just didn't know how rapidly it would spread and who it would affect. There were all these predictions at the beginning that said people with HIV and people with cancer are going to do terribly because of COVID-19, and we just haven't seen that bear out. And so I think it's only by having people being back in schools that we would ever know what exactly the effect of this virus is on the older populations in the school. So the teachers, the principals, and those type of things. So I think we'll start to find out about that data, I'd say probably in coming weeks to months, because I think that there's a lot of folks looking at that. And, if you look across the news and if you talk to people who live in different states, education is being done differently at a lot of places. So here in Texarkana, we have a lot of children in school. There's a hybrid option. Parents were given an option if they want to have their children in school versus to do distance learning. A lot of other school districts across the country have said, we are just absolutely doing virtual only. And there are several school districts who decided to delay the start of in-person learning and did virtual for the first half of the school period, and then just started putting the kids back in in-person classes at the beginning of November or the beginning of October. And of those, several have had to go back to virtual just because they're seeing transmission of the virus. And that's just because of the fact that that virus is still high in high prevalence in communities across the country. There's a good question in here about groceries. So should groceries be cleaned with soap and water before being placed in the pantry or refrigerator? So we know that COVID-19 can stay on surfaces. And so if you think about it, you've got people in the grocery stores who are unpacking pallets of, say it's a box of sodas, or it's one of those 6-packs that's on the rings of Coca-Cola, or the little 8-packs. So someone has touched those cans, and then you're touching those cans, and you may touch something in your house or touch your face or then go to eat something. And so while it may seem like a lot of work to wipe everything down, I can tell you, our house, we're not wiping anything down, but we are washing our hands. But I have friends who are doctors who wipe everything down. I have friends who take their groceries, leave them out in the garage for 24 hours before bringing them in. And, I think there's just not great data on any of these, processes or procedures that are going to prevent you from getting it. I think washing your hands after you handle something is a good idea. I think especially for things like cans and packages, you might want to wipe them down. I don't think that you're much more likely to get COVID-19 from direct contact with a person than from kind of an item in your household. There is a question on here about a student testing positive. So this has been interesting to observe over the past, I'd say, 2 months. So each school is reacting differently to someone testing positive. So we've had notifications of if a teacher tests positive, then the whole classroom is sent home to quarantine. And the number of days goes anywhere from 5 to 7 to 10 to 14, which is curious. We've had situations where one child in a class tests positive and everybody goes home to quarantine. At my child's daycare, I got an anonymous note yesterday that they gave to all the parents that says that they've had somebody test positive at the daycare and they're required to let us know. However, they didn't have to close the daycare. Now, 3 months ago, we had daycares that were closing down when they had somebody who tested positive. Now they're just required to alert people. I do think that the policies that the state has put in place in Texas about not allowing parents to go into daycares, I think that has really helped in terms of keeping healthcare workers, keeping daycare workers, keeping everyone inside those daycares healthy, because you're having less exposure to the children and to the workers in the daycare. And so I think that is definitely helpful in keeping people safe. When I talked to the daycare and they gave me this note on Friday, they were saying all these parents are so nervous, everybody's worried, people were crying. And I said, I'm surprised that you all made it 9 months before you had one. So this, to me, I was impressed. I remain impressed at how vigilant the daycares have been. I think in a daycare setting and in a nursing home setting, you already have to be so vigilant about hand washing, about germs, about infections, that I think those policies that were probably already in place and then we're just taken to the next level is why I think our daycares in this area have done so well. We've had a couple that had to close down. And I don't think that was due to just rampant COVID-19. I think it's also just difficult depending on who gets COVID-19 in a daycare. It's just difficult to find another provider to take care of a class and to shuffle the kids to make sure that you still have the safe staffing ratios. I think that the standard of practice probably should be that if you have a child in a classroom or if you have a teacher who's had close contact and they're not wearing masks and they're test positive, it does make sense that those children or that class would quarantine because that meets the definition of a close contact per the CDC. So if you've had more than 15 minutes with someone not wearing a mask, if you think about a teacher in a room full of students, they're in there for at minimum 30 to 45 minutes, if not several hours during the day. And so that would be a definition of an exposure. And per the guidelines on the CDC website, those children should quarantine at home and monitor to make sure they don't become sick. Other questions that are coming in. So Ms. Moss saw something about drinking ginger root tea that keeps the blood from clotting. So that's another one of those natural remedies. So one of the very significant complications of COVID-19 that people did not realize at the beginning is that COVID-19 makes your blood thicker. Because of that, we have people who are more at risk for a heart attack, more at risk for stroke, more at risk for blood clots in your legs, more at risk for blood clots in your lungs. And so any patient who's admitted to the hospital with COVID-19 gets either put on aspirin or a blood thinner to make sure that we can keep their blood thin. That recommendation has not been made formally for people who are at home taking care of themselves with COVID-19, but I think that we will see that come through as a recommendation eventually, that if you're at home and you're tested positive for COVID-19, taking a baby aspirin will help keep your blood from getting too thick. The ginger root tea is kind of like a natural remedy for people who have issues with their blood clotting too easily. And so that if you are somebody who prefers more of a natural remedy, ginger root tea would be an option for that. There's a question about the symptoms. So, at the beginning of this, everyone was like, oh, this is a respiratory virus. You will have severe difficulty breathing. You may end up on a ventilator in an ICU. And then they realized that there's a lot more symptoms than shortness of breath and difficulty breathing. The most prevalent symptom, or the symptom that's most likely to be a true symptom of COVID-19 and not related to other things, is this loss of smell and taste. And this is a fascinating one just because a lot of people who have allergies will say, oh, my nose gets stopped up all the time and I can't smell things. Or, when the seasons change, I get this. The interesting thing about this loss of smell and taste is that there can be sometimes no symptoms other than that. So you wouldn't have sneezing, you don't have coughing, your nose is not congested at all. And so a lot of people will think it's their allergies, they'll take their allergy medicine, take their nasal spray, and still can't smell anything. This loss of smell and taste, they're saying, can last for weeks to months. So even once you're better and over COVID-19, this can still last longer. So that is an interesting one that has emerged, I think, later in our understanding of the virus. And then there's been some studies around who is more susceptible to get severe infection. So there's a study out that says having O positive blood gives you a higher likelihood of having mild symptoms. There's also a study that says, the one that came out this week that has people very concerned, that shows that pregnant women have a higher risk of having severe disease. That said, I will tell you that pregnant women have a higher risk of having more severe of any disease they get. So pregnant women who get the flu get sicker. Pregnant women who have diabetes have a harder time with their diabetes when they're pregnant. So pregnancy itself is a state of having your immune system in constant overdrive. And so no matter what, a pregnant woman was going to be at a higher risk. Things that we can do is to make sure that if you're around a pregnant person, wearing a mask to help protect that person. If somebody is a pregnant person who works at the hospital, and at our hospital, we are recommending that our pregnant staff members don't work on the COVID floor. We're also recommending that they don't work in the emergency department, just because you just never know what type of patient you're going to encounter in the emergency department. And we're asking people who are pregnant to talk with their OBGYNs to find out what's the appropriate solution for them. So there are some people who are pregnant who are adamant that they feel comfortable working in the emergency department and they're not worried about COVID, and they'll wear their mask and their personal protective equipment appropriately, and they just feel more comfortable working in the emergency department, and we are respecting that choice. We're not forcing somebody to work somewhere else, but we do know that that data is out there. It is difficult to predict who is going to have severe disease versus who is not. I don't think that we have a good algorithm for that yet. I will say that in terms of our mortality or our deaths at the hospital, most of those are occurring between the ages of 65 to 80. Ironically, our patients who are above the age of 85 up to 101 have been doing very well. We had a patient who was 101 who got discharged from the hospital. And then we'll have someone who's in their 50s who ends up having a prolonged hospitalization on a ventilator. And so just because you're young doesn't mean that you're automatically going to do well. And just because you're more seasoned doesn't mean that you won't. And so I think that that's important for people to know as well. Ms. Gamble Williams has a question here about what advice would you recommend for the holiday season? You know, I think it's going to be difficult. I think people in general are tired of COVID-19. And I think, to be completely honest with you, even though the public health advice is for people not to assemble and not to gather, I think that a lot of people are going to, just because they're tired and they're isolated, and kind of nothing feels better than family. You know, I think the best thing that people can do really probably is to wear masks when they're around their family. If you're in large groups at a family gathering, masks are going to be helpful in protecting you. I would say in general, the public health advice would be don't gather in large groups. But I would say if you're going to do it anyways, at least wear a mask. I think it's difficult also because, you know, the point of Thanksgiving is obviously coming together and being thankful for our family and friends, but it's that food. And I have not yet figured out how to eat with a mask on. So I think that is going to be a challenge. And I think even, you know, in our community, a lot of restaurants have opened up. People are going in to either pick up food and go or sit in the restaurant and eat. And, you know, people are concerned about restaurants opening up or this or that. But the fact is, you know, you could have a restaurant with just 2 people in it eating, and you all are sitting, you know, about 2 feet away from each other. And if someone has COVID, that other person is probably going to end up with COVID-19. And that's whether it's 2 or 90 people in there, just because eating is requiring you not to have your mask on. So I think that it will be a challenge over the holidays. I think that trying to see how air travel is going to be another piece, is in that some countries are now requiring that you have a COVID-19 test a certain number of days before you travel to a place. You know, the United States does not have a good rap in the international community right now. So if you try to fly anywhere outside the United States, when you land and they see that U.S. passport, they're going to request and require that you quarantine, usually for 14 days. I don't have enough PTO to take a vacation where I have to stay inside for 14 days before I can go anywhere. So just be thinking about that as you think about traveling, and even to states. So I have a friend who is in New York City, and she won't be able to go home for Thanksgiving because New York has a list of states that if you go to any of those states, when you come back, you have to stay in your home for 14 days. Texas is one of those. We're on everybody's hot list. I don't even check anymore because we're always at somebody's top. But I think that makes it difficult for folks kind of coming into Texas. It makes it difficult for people leaving Texas. And, while I could say Texas for a while, Arkansas has joined us in the illustrious top. And so Miller County has now been on the top 5 counties for the past couple days in Arkansas. And so we are still in a hot spot. And so we are probably not welcome kind of outside of our area. Somebody asked about, can you contract COVID from food? So they haven't been able, they haven't been able to get good data on foodborne transmission of COVID. They don't have any cases of that yet. More than likely, the droplets, because your food is, whether it's too hot or too cold, viruses aren't great at kind of living on food items. They're much better at sticking to surfaces. So if you have something that's in a Tupperware container, it's much more likely that the COVID-19 would be on the top of that Tupperware container or on the foil or on a doorknob or something like that. They like to stick to kind of a hard surface that they can cling to. I think that food just has too many kind of textures and variation in texture for that COVID to be able to stick to. But like, they looked at doorknobs, they looked at faucets, they looked at containers, and COVID likes to stick to things like that. All that said, I probably should be wiping down my containers now that I think about it. But food itself, even if somebody with COVID-19 breathes on it, I think it would be difficult. I think, one, because of the food itself, but then also we have so many enzymes in our mouth and in our stomach that helps to break down food that will also break down viruses. And so when you're eating food, either the temperature of the food combined with the strong enzymes that we have and acid in our stomach breaks that down. I know that was a lot. What other questions? And I'm always available. Ray knows, like, I love to talk to folks and answer questions, so I'm happy to take more. I have a slide presentation that I put together that I will email out. I'll send to Barbara. It's fascinating. I put it together a couple of weeks ago, and now I updated it for this meeting so that you can see the difference. Just in terms of where we were in terms of COVID a couple weeks ago. We do have remdesivir treatment at Christus St. Michael Hospital. I do believe they have it at Wadley as well. That is the antiviral medication that's been FDA approved. That said, I wouldn't say that it is a be-all and end-all. So just because you get it doesn't mean you're going to do well. And if you don't get it, that doesn't mean you're not going to do well. I do think we're going to be trying to give it to people earlier in their disease. Right now, it's an inpatient only, meaning you have to be in the hospital, but I think they're working to try to get it made available as an outpatient so you don't have to be admitted to the hospital to get that medication. The other thing is around vaccine. So there's not yet a vaccine out. I hear that they're supposed to have a vaccine ready by the end of this month. Ray will tell you also, I'm not a secret holder. I'm not getting a vaccine anytime soon. I think that this was rushed. We don't have great science or understanding of the virus itself, let alone a vaccine. And I think, as you all can see, we've had at least 2 vaccine trials that have been halted because of terrible effect or because of side effects, including a death in one study. And even in one of the monoclonal antibody treatments, had to stop their trial because they had somebody who had a serious side effect. So I do think it's worth us putting time and energy and resources and prioritizing how do we develop a vaccine safely? How do we make sure that we can treat people safely? But doing it fast is never good. And I think if you look at that ballot count in the state of Georgia, if you look at that ballot count in the state of Pennsylvania, I'd rather be accurate and complete than fast. So yes, I love it. Someone asked my specialty. I am internal medicine and pediatrics, and I'm not practicing clinically right now. I'm in the hospital administration over at Christus St. Michael, and my role, like Ray was saying, is to improve our quality efforts, and then also to recruit physicians. I'm a little biased. I would love to recruit a lot of physicians of color to our area, so we're working on that. There will be a brother joining us from the Fort Worth area in December who will be our new radiation oncologist at the hospital. He and his wife and their sons will be joining the Texarkana community, and so I am so pleased about that. And so I hope we can continue to grow the community and mentor and grow our homegrown talent as well, because I think that is a big one. And then the other thing about vaccines, and Ms. Moss brings up a good point, is that viruses and bacteria like to mutate. So when there is pressure on a virus or on a bacteria, or when you start throwing a whole bunch of different treatments at things very quickly, and we saw this with HIV, the virus can mutate and escape. And so that's also a concern, that if we develop a vaccine too quickly and we give it and the virus mutates, that vaccine would not be useful at all. We are having conversations. I will tell you that Christus Health is having a conversation. I think on the heels of all the racial injustice conversations, there's this desire to want to make sure that underrepresented and underserved communities have access to the have access to the vaccine, which I appreciate this push toward equity. However, I think also on our community specific understanding of how the federal government conducted, sanctioned, and kept the Tuskegee experiment going for about 45 to 50 years too long. I just have concerns about the safety and transparency about the vaccine at this time, and I'm concerned about a push to kind of push it out to minority communities, or push it on minority communities, or incentivize minority communities to get it, paying people $50 to get a vaccine. I just want to make sure that this is very ethically done as well. And so I think, especially as this comes to our community, that might be a conversation for NAACP to, just keep our eye on. I know that the vaccine is supposed to be coming to Christus. They're excited to bring it to Christus Trinity Clinic. I haven't talked to Colin McCarney or Dr. Stussy or any of the folks locally, but I think that we as a community need to keep our eye on that, just to make sure that we're not having anything happening to our community as that vaccine starts to roll out.
Well, okay, Dr. Robinson, I'm Robert Jones. First of all, let me welcome you to the greater Texarkana area. I just recently found out that you were here, and you did an awesome job this morning. So we really, really appreciate that. And now we got you on speed dial, so don't be surprised if we be calling you more often. But we really, really appreciate you. I want to thank Ms. Thigpen and her committee for allowing you and getting in contact with you to come and make this presentation this morning, because I really enjoyed it. And I'm almost sure from the comments that I've been reading that everyone was really impressed by this presentation.
Thank you very much. And anytime, I'm glad to connect with the community, and I believe in lifting as we climb. So any way I can help out, just let me know.
Mr. Jones, this is Ray again. I just wanted everybody to know, you see how passionate Dr. Robinson is regarding health, as well as what's going on with COVID. So we really appreciate her coming to share with us, and we will certainly be keeping in touch with you.